Hi, and welcome to the International CPR Institute CPR training video. Let's get right to it. CPR is not a complicated process. It's very simple. We'll walk you through the steps so that you'll know what to do in case of an emergency. Let's just say you come upon a victim, whether it's in an office situation, in your home, or just out on the street. The first thing you want to do is assess the situation. By assess the situation, I mean don't put yourself in harm's way. Make sure you're not jumping into something where you're going to get hurt yourself. Is this person lying here because he was just electrocuted and there's a live wire in the area? Or is he in a room where there are toxic fumes and you're going to kneel next to him or her and try and help and find yourself laying down next to them unconscious yourself? So we want to make sure that the scene is safe. Once you determine the scene is safe, it's time to act. Now, the first thing you want to do is to make sure that this person truly needs help. Could be just sleeping there. So while you're checking to see if this person is okay, you're checking for breathing at the same time. It's important you remember at the same time. We don't check for breathing, then see if they're okay, or vice versa. While we're seeing if they need help. Hey, are you all right? Hey, are you all right? Wake up, wake up. Nothing. I determine that the person's not responding and they're not breathing. It's time to do CPR. And CPR for an adult starts with calling for help. Now, if you're alone, you have no choice. You have to just call. Hopefully you have a cell phone and you call. But if there's someone else in the room with you, your friends are there or your co-workers, whatever, direct someone specific to call 911 or whatever the emergency response number is in your area. Mary, call an ambulance. Joe, see if there's an AED. Make sure they know that you're speaking with them. Because if you start screaming, somebody call an ambulance, everybody may think that someone else is doing it and it doesn't get done. Now let's just say you're alone. You have to call first. With an adult and a child, you will make the phone call before you start CPR. Now, a child is defined as between the ages of 1 and the onset of puberty. Puberty is usually between 12 and 14 years old. And then an adult is anything older than that. So if you come upon a victim that's over a year old, you're going to call first. Very simply, you're going to call, in this area, it's 911, and speak with the operator. The operator is trained. They're very well trained now in assisting you and walking you through the process. If you don't know CPR, they will walk you through it. But if you do, you're going to say something like, "Hi, my name is Joe Smith. I'm at 123 Main Street. I have a victim. He's unconscious and he's not breathing. I'm going to start CPR. Yup, the front door is open. Just come in the front door." At that point, don't put the phone down. We want to make sure that they got everything correctly. So you're going to wait for them to repeat it. Let me get this straight. You're at 123 Main Street. Come in the front door. Is that correct? Yes, that's correct. I'm trained in CPR and I'm going to start CPR. I'll leave the phone open. At that point, you're going to hopefully remember to put the speaker button on, but if you don't, that's fine too, because they can still hear you. And we're going to place the phone right next to the victim. You want to have some sort of communication between you and that operator, because they're going to keep the ambulance advised of what's going on. Now it's time to start CPR. Remember CAB, CAB. It's compressions, airway, breathing. We start with compressions, we open the airway, and then we breathe for that person. So compressions first. With an adult, it's at least, the compression depth is at least 2 inches, but no more than 2.4 inches. Now they put an upper limit on a compression now. We were trying to minimize the amount of damage that's done to the sternum and the chest area. So it's at least 2 inches and no more than 2.4 inches. With a child, again, ages 1 through the onset of puberty, it's about 2 inches. And with an infant, it's 1/3 the depth of the chest, which is about 1.5 inches. So again, with an adult, it's at least 2 inches and no more than 2.4 inches. That's a very deep compression, so you really have to press hard and press fast. With all ages, the number of compressions per minute is 100 to 120 compressions per minute. That's the rate. So you really have to press hard and you have to press fast. 120 compressions a minute is 2 per second, so you really have to press hard and press fast. Now this operator is listening to you. You don't want to lose count, So when you do your compressions, I really recommend that you count out loud. You're going to compress with the heel of your hand, you're going to interlock your fingers, and you're going to have your shoulders over the victim's chest. You see how my shoulders are straight down? Now, the thing you don't want to do is to lean on the victim. We want to maintain contact, but we don't want to lean on them. Because once you compress and recoil, you want that compression to recoil and the chest to recoil totally. So if you're leaning, the heart isn't going to compress totally, or uncompress totally, I should say. So we're going to have your shoulders over, count out loud. 30 compressions to 2 rescue breaths. That's the ratio. So here we go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. That's 30 compressions to 2 rescue breaths. So CAB, compressions, airway, and airway just means we're going to pinch the nose, tilt the head back, and that will clear the airway so that your rescue breath will actually go into the lung. When you're breathing, make sure that chest is rising and falling. If it's not, it could be a blockage, and maybe that's why they're in trouble, because there's a blockage and they've just choked, and that's why they passed out. So we're going to clear the airway by pinching the nose, lifting the chin, and giving 2 rescue breaths about 1 second, at least 1 second. Okay, the guideline is at least 1 second. I realize that 7 seconds is at least 1 second. What they're looking for is at least 1 second or thereabouts. Not 3 seconds or you're going to pop the lung. At least 1 second. So we're going to pinch the nose, lift the chin, watch the chest rise and fall. 2 rescue breaths, 30 compressions, 2 rescue breaths. Now, the time between rescue breaths and compressions should be very minimal at best. So the minute you stop, the second you stop giving the rescue breaths, go right back to compressions. Again, don't lean, but make sure your shoulders are over the victim's sternum. Okay, very simple. It's the same with a child and an adult. We call first, a child about 2 inches, an adult at least 2 inches, not more than 2.4 inches. With an infant, it's different. If you find an infant unconscious, more likely it's a respiratory problem and not a heart problem, more likely. So if you find an infant unconscious, we're going to run through 5 cycles of CPR before we make the call. Because like I said, it's more likely respiratory, and the faster you get air into that baby's body, the more likely they have a chance to survive. So if you find an infant, we're going to give compressions, airway breathing, but they're not done with the heel of the hand. They're done with either 2 or 3 fingers. I personally prefer the 3 fingers. I have a little bit more strength with the 3 fingers. It's got to be 1/3 the depth of the chest, about 1.5 inches. So you're going to compress like this. 1, 2, 3, 4, 5, 30 compressions. And then your rescue breaths are going to be slightly different. We're not going to pinch the nose. We're not going to tilt the head back so much. We're going to really use our mouth to surround the nose and the mouth on the infant, and we're going to give puff breaths. They have very small lungs, infants, so you don't want to blow too hard or you're going to pop a lung. It's just a balloon there. So surround it. 2 rescue breaths. Make sure the chest is rising. Now, if you don't see the chest rising on an infant, chances are that infant's unconscious because they're choking. So you're going to clear the airway, make sure there's nothing in the mouth, and if that doesn't work, we're going to turn the infant upside down, support the head and the neck, and you're going to give 5 back blows to try and free whatever's there. Okay? And then once you do that, you turn them this way again, do the whole process over again until you get some air in there. If they're not getting any air, they're in trouble, and you're going to have to clear that airway. Again, let's just go over it very quickly. With an adult and a child that's 1 year and older, you're going to call first. With an adult only, you're going to give compressions at the rate of 100 to 120. That's the same for everyone. 100 to 120 compressions per minute, and the compressions for an adult are at least 2 inches to 2.4 inches. With a child, it's 100 to 120 compressions per minute also, at a depth of about 2 inches. Okay? You don't want to go too deep with a child. With an infant, it's 2 or 3 fingers. It's still 100 to 120 compressions per minute, but it's done with 2 or 3 fingers. 1/3 the depth of the chest, which is about 1.5 inches. That's the entire process. The minute that a AED is brought to the scene, we're going to hook this up and we're going to turn on the AED, and in most cases it'll advise to shock. You want to do that immediately, but you don't want to stop CPR if you're not alone. If you're alone, you have no choice. You have to open that AED, you have to hook it up, and you have to shock. And then immediately after delivering a shock, we go right back to CPR. Okay? The AED will advise whether or not you have to give another shock. If you have someone else there, have them do all of that. Have them on the other side of the victim, hooking up the pads while you continue CPR. CPR can be very grueling and can be very difficult to maintain. Those 30 compressions, you can hear I'm winded after giving 30 compressions. So if you have someone else with you, try and switch. One gives rescue breaths, the other one gives compressions, and you go back and forth. How about hands-only CPR? Hands-only CPR is to be used if you are unable or unwilling to give rescue breaths. If that person is foaming at the mouth and you don't have a barrier device, we all understand. No one's going to put their mouth on that person and start giving rescue breaths. But do something. Most studies have determined that the hands-only CPR can be just as effective. So if not, you're just going to give constant compressions. You're not going to stop to give rescue breaths. And make sure that the operator knows that. I can't give rescue breaths, I'm going to just do hands-only CPR. They will advise the ambulance that you haven't delivered any rescue breaths. And that's basically it. Very important, when an AED gets to the scene, then that's when you hook it up and use it as quickly as possible.